I remember very clearly on Sunday, I had to like get up and go to the grocery store, and I just couldn't. Like it was like there was a weight like sitting on my chest, and I got up and I felt like I was at the store and I saw people, but it was like no one was really there. And like my friends reached out to me and they were like, "Hey, are you doing okay? Like you just have seemed kind of distant." And there was a part of me that wanted to talk to them, but also a part of me that just wanted nothing more than to be left alone.
Isolation and loneliness are two really key known risk factors for mental health problems and for suicide in particular.
We're not just talking about being locked at home and being bored, and some of us can't go to our favorite restaurant. For some of us, like, we had whole vocations and careers that were centered around industries that included being around people. For some of us, we had to give up on our dreams. For some of us, we lost someone that we love. For some of us, this wasn't just a cute little exercise of getting some quiet time. It was devastating, and it changed everything permanently. And so there's no shortage of intense suffering down in the roots of who we are. And if you're gonna shove that down and try to force it with some sort of positivity mumbo jumbo about like, I just gotta get through it, then it'll haunt you and it'll stay in the roots of you.
About half of college students screened in a recent Boston University study were positive for depression or anxiety. One of the experts behind the study is Dr. Sarah Lipson.
So my research focuses on mental health in adolescent and young adult populations, so a public health approach to thinking about mental health during that time. The college environment provides access to a large proportion of all adolescents and young adults. There's about 22 million young people who are enrolled in U.S. post-secondary education. And it is the age of onset for lifetime mental health problems. So 75% of lifetime mental illnesses will onset by age 24.
According to Dr. Lipson, on average, it takes about a decade for people to seek help.
The median delay from when someone experiences symptoms to when someone accesses services for physical health problems is significantly shorter than for mental health problems. And many people never seek services. And of course, suicide is an enormous factor in this country.
Thank you so much for taking time to chat with me about this.
Absolutely.
This is Matthias Barker, a psychotherapist in Spokane, Washington.
I think we're gonna get back into normal life, hopefully soon, and realize like, wow, physical touch was such an important part of my connection with people that I just didn't even realize. And like I was talking to a friend of mine who's a scholar in the field of around like anxiety and anger, and he was just like, I haven't had a hug in months. like from someone other than just like my child. Like I haven't hugged my friends, and he was just sitting with that. There's something really, really human about just the physical touch and the ways that we connect with people outside just these digital platforms that maybe isn't right in front of us, right? We can't put words to it easily. Like even as I'm describing it, it's hard to place it, but it has real substance and it matters. So I think we're gonna find that out as time goes on.
I don't know if it was because of the change in weather. I don't know if it was because it hit me that, wow, I really do have to stay on Zoom for probably another year. I just lost all motivation, everything that had been previously driving me to keep going, I lost sight of it because I was like, well, what's the point when I wake up every day and I do the exact same thing? I don't see or feel or touch like anyone. And like, I don't know, it was just, I think just coming to terms with the fact that nothing about my life would like change for a while or so. And I felt this sense of like isolation, disconnection.
Okay, still at my desk, and now I'm getting ready to go to my last Zoom class of the day.
I mean, everyone is dealing with feelings of loneliness and isolation to some degree, but the adolescent and young adult time period is really, it's defined by the relationships that you have with your peers, by social connections. In particular, college life is really defined by that.
I had that moment where I was just like sobbing, and I recovered from that pretty quickly, but like, I think in general, I'm doing better. I have a good support system, but there are still little moments here and there where I just burn out. And like, I've worked so hard and then something just hits and there's too much work at one time, or it's too much to deal with mentally, and I'm just like overwhelmed.
Okay, suicidality is down. Does that mean health is up? It's not that simple, because what we're talking about is a whole ecosystem of how ideas and coping mechanisms and suffering are interplaying with each other. And I think what I've seen on the rise more than anything is loneliness. And it's not obvious to me that suicide is the right tool for that one. Maybe connection is.
Getting through it is easier said than done. One problem many face is finding help. Within the last year, Matthias has taken his work to TikTok, reaching 1.7 million followers. Thanks to the work done by him and others, the stigma around mental health has gone down, but the lack of resources continues to be an issue.
The wait list for mental health services is really long on a lot of college campuses, and even worse, access outside of the college setting.
Like, we're all stacked, and like, I have a waiting list that's years long right now, because and it's my first year in the field, because we just have so many people that are struggling.
It's another really big priority as we talk about this. Is stigma has been going down. Young people are having these conversations more. They're much more open to seeking services, and yet the actual act of seeking help can be really difficult when there aren't services available to you.
Suicide is a tool that's meant to fix a problem, quote unquote. So the problem is, like, this pain is so unbearable that I just can't bear it any longer. Like, existence is just too much to hold. Or maybe the problem is I just feel like such a terrible person, and the people in my life would be better if I wasn't here. Like, there's all sorts of problems, quote unquote, that suicide, it doesn't, but it appears to solve.
Not that we need a reason or an explanation for how we're feeling, but there are so many reasons to feel these negative emotions right now.
We are often our biggest critics. It's easy to compare our situation to those around us or across social media. The fear of being judged is usually a reason for stopping people from getting help or even having the conversation. But one of the positives from Dr. Lipson's research was that 94% of college students say that they would not judge someone for seeking help for mental health.
Hey everyone, Cody Broadway here. Thank you so much for taking the time to check out the NBCLX YouTube channel. Be sure to click here for more videos, and also click here to subscribe to join the NBCLX community.